You slip on a wet rock and a sharp branch tears open your thigh. Blood runs into the dirt. It's 50,000 years ago. There's no hospital, no antibiotics, no bandage, no doctor anywhere on Earth. A cut like that can kill you in 4 days. Infection gets in, your leg swells, fever takes over, and you're gone. So how are you here? How did hundreds of generations survive injuries that should have erased them? Start with what we dug up. In a French cave, researchers found human skulls with round holes cut straight through the bone. This is trepanation, the oldest surgery we know of, dating back about 7,000 years. Someone drilled into a living person's head with a sharp stone. And here's the part that stops people. The bone around the hole had grown back smooth. That smoothing only happens if the patient lived for years after. In some sites, more than half of trepaned skulls show healing. These people cut open heads, and the patients walked away, so they understood something. The body can be repaired. But surgery is the loud evidence. The quiet evidence is plants. In a Spanish cave called El Cedrón, scientists scraped hardened plaque off Neanderthal teeth. Trapped inside were traces of yarrow and chamomile. Both plants taste bitter and hold no calories. There's no food reason to chew them. Chamomile calms inflammation. Yarrow slows bleeding. A Neanderthal was using them as medicine 50,000 years ago. Then there's the most complete example we have, a frozen man. In 1991, hikers found Otzi in the Alps, preserved in ice for 5,300 years. In his gear, he carried 2 lumps of birch fungus threaded onto a leather strip. Birch fungus kills bacteria and fights gut parasites, and Otzi's intestines were full of whipworm. He carried the cure for the exact parasite inside him. His body also told another story. 51 tattoos, mostly small lines over his joints and lower back. X-rays showed arthritis right under those spots. The tattoos sat exactly where he hurt. This was pain treatment carved into skin. Now the wounds themselves. How do you stop a cut from rotting? Egyptian healers wrote the answer on papyrus. They packed open wounds with honey. Honey pulls water out of bacteria and starves them. Hospitals still use medical honey dressings today. They got it right 3,600 years ago. For broken bones, the fix shows up in skeletons everywhere. A snapped arm, splinted straight and bound, knits back together in 6 weeks. We find old healed fractures lined up almost perfectly. Someone knew to pull the bone back into place and hold it. Some of you are thinking, sure, but did any of this actually work? Fair question. And the answer is in your own medicine cabinet. People chewed willow bark for fever and aches for thousands of years. Willow bark contains salicin. In 1897, chemists turned that compound into aspirin. The pill you take for a headache started as bark. The mold growing on old food fought infection too, the same mold that became penicillin in 1928. Folk healers were brushing it onto sores long before that. They didn't know the chemistry, they knew the result. But the real medicine wasn't a plant or a tool. It was the group keeping you alive while you healed. A broken leg means weeks where you can't hunt or gather. In the wild, that's a death sentence. Yet we keep finding skeletons of people who couldn't feed themselves, living on for years anyway. Someone carried them, someone shared the food, someone chewed it soft and brought them water. No other animal nurses its wounded back over months. And memory mattered as much as care. An elder who survived a snake bite remembered which plant helped. She taught the next generation, who taught the next. Every survived injury became a lesson the whole group kept. By the time writing arrived, that knowledge filled clay tablets. Sumerian healers listed dozens of remedies around 2400 BC, mixing crushed plants, salt and beer into treatments. Egyptian surgeons wrote down how to close a wound, when to set a bone, and when a case was hopeless. They had honest categories for what they could and couldn't fix. Look at the full picture and it changes how you see them. They drilled skulls, and the patients lived. They carried antibacterial fungus across mountains. They dressed wounds with honey that still works in hospitals. They chewed the bark that became aspirin. They fed the people who couldn't feed themselves. For most of human history, there was no medicine in a bottle. There was a sharp stone, a known plant, and a circle of people who refused to let you die alone. Every cure we swallow today started as something they figured out by watching, remembering, and trying again. We didn't survive because we were strong. We survived because we paid attention and we took care of each other.